Hi, once again welcome back to obstetrics and gynecology videos. Today we are going to see about the diagnosis of pregnancy. We are going to see how to confirm whether you are pregnant or not. We know that the normal duration of the pregnancy is 9 months and 7 days if you are telling in months. And it is 280 days if you are telling in days, and if you are telling in weeks it is 40 weeks. And this calculation is known as gestational age, and this gestational age means it's the duration of pregnancy. For example, if the mother is at 7th month, that is we are telling 28th is the gestational age, and 28th week is the gestational age of that particular lady. And this gestational age we are calculating from the first day of the last menstrual period, that is known as LMP, last menstrual period, first day of last menstrual period. From that first day, if you are adding 9 months plus 7 days, you will get the expected date of delivery also. This total 9 months duration of pregnancy is divided into 3 sectors, that is 3 trimesters, first, second and third trimester. First 3 months from the conception to the 3 months is first trimester, 3 to 6 months is second trimester, 6 to 9 months is the third trimester. That is, if you are telling in weeks, first to 12 weeks is first trimester, 13 to 28th week is second trimester, 29 to 40th week is third trimester. And now let us see how can we diagnose the pregnancy in the first trimester. It can be based on the signs and symptoms of pregnancy. And first let us see the symptoms which will be evident in the first trimester or in the first 12 weeks of pregnancy. First one is cessation of menstruation, that is stoppage of menstruation or missing of the regular menstrual cycle. Most probably you will be going for the father test after missing your cycle only. And this missing in the cycle is due to the increased estrogen and progesterone production by the corpus luteum. This high estrogen and progesterone will suppress the production of LH and FSH from the pituitary that we have seen in the menstrual cycle. But even menstruation is not there also. Sometimes few ladies may get slight bleeding at the time of menstruation, and it will be there up to 3 months, and this is known as placental sign or Hartman sign. During the normal menstrual cycle time, even if they are pregnant also, they won't get the menstrual flow or bleeding as like the normal menstrual flow. They'll be having slight bleeding until the residual space is getting obliterated completely. Slight bleeding will be there, and this slight bleeding at the time of menstruation, even during the pregnancy, that is known as placental sign or Hartman sign. And we should not think that it is a sign of threatened abortion. Next symptom is morning sickness. 50% of the ladies will be having the morning sickness, that is excessive nausea and vomiting, especially in the early morning immediately after rising from the bed. And in majority of the cases they will get this morning sickness or vomiting immediately after missing the period onwards, and in normal cases it will disappear after 3 months. But if it is an abnormal condition, that is hyperemesis gravidarum, all those things, it may persist even after 3 months also, but normally it will disappear after 3 months. And next one is frequency of micturition, and this is due to the congestion of the bladder mucosa and due to the anteverted of the uterus. Already I told you that in the anatomy and physiology of the reproductive system, I have explained that the uterus is in an anteverted position and it is lying over the bladder. And when pregnancy is occurring, when the gravid uterus is lying over the bladder, bulk of the uterus will be increasing, and that will apply pressure over the bladder. That is also a reason for this frequency of micturition. And another reason is changes in the maternal osmoregulation that leads to the polyuria, that is excessive urine production, and because of that lady will get increased thirst also. And this polyuria frequency of micturition will disappear after the 3rd month, because by 3rd month this anteverted uterus will become erect, that we have seen in the normal physiological changes during the pregnancy. In case if you are having any doubt, you can see the previous video about the physiological changes during the pregnancy. Next is the breast symptoms. Enlargement, heaviness of the breast, discomfort and prickling and tingling sensation of the breast also will be there between 6th to 8th week of pregnancy. And mainly it is due to the increased circulation or increased vascularization to the breast. Next is appetite changes. The lady will be craving for certain type of food and she will be refusing certain other type of food. Sometimes it may be due to the nausea and vomiting, and if she is craving excessively for a certain type of food, that is known as and if that craving is for unnatural substances, that is if it is for the chalk or if it is for the mud or stones, such unnatural things, if they are craving for that, that is known as the pica. And another symptom is fatigue. Frequently the lady will be having the fatigue and they will be having a tendency to sleep also. Next, we can see the objective signs. The objective signs in the first trimester of pregnancy include breast signs, that is more clear in the primigravida mothers. Already I told you that prickling and tingling sensation will be there, and it is due to the increased vascularity. So increased size and vascularity of the breast will be there, and because of this increased vascularity, the veins will get dilated and it will be visible over the surface vein will be visible over the breast, and increased pigmentation of the nipple will be there. That is appearance of secondary areola and primary areola will be there, and this will become more in thickness also. And Montgomery tubercles also will develop over the breast. These are dilated sebaceous glands. These explanations already I have given in the physiological changes during pregnancy. In case if you are having any doubt, please go through the previous video about the physiological changes. And we can express colostrum from the 12th week onwards. And if you are looking into the structure of the breast, in the normal case, non-pregnant breast will be like this, and the nipple will be small without much pigmentation. And in the early pregnancy, the size of the breast will increase, and this pigmented area circumference also will increase, and the nipple size also will increase. And when you are coming to the late pregnancy, see, it become more discoloration of the areola is there. Primary areola and secondary areola also has formed, and more pigmentation is there, and the nipples also become large in size. And I told you about the appearance of Montgomery tubercles. Already I have told you that these are dilated sebaceous glands. It helps for the moisturization. So these are the Montgomery tubercles. And if you are coming to the abdomen, up to 12th week, the uterus will be inside the pelvic cavity, but by 12th week, it will just enter into the abdominal cavity so that you can feel it per abdominally as a suprapubic bulge. Just above the symphysis pubis, you can feel it. And the pelvic changes include Jacquemus sign or Chadwick sign, Osiander sign, Gödel sign. Jacquemus sign or Chadwick sign means dusky hue of the vestibule of the anterior vaginal wall, and it is visible by 8th week, and it is due to the more vascularization and vascular congestion, and it is more clearly present in the multigravida mothers. That is discoloration of the vagina, dusky hue vestibule of the anterior vaginal wall, and it will appear from 8th week of pregnancy. Next is Osiander sign. It is the increased pulsation that can be felt to the lateral fornices by 8th week of pregnancy onwards. And this is also due to the increased blood supply. And next is Gödel sign. The Gödel sign means the cervix will become more soft, and you can identify it from 6th week onwards. Softening of the cervix is more surrounding the external os and in the upper part. And if you are palpating it, you can feel it like the lips of the mouth. And on speculum examination, you can see bluish discoloration of the cervix also. And this is due to the increased vascularization. So Gödel sign means it is a softening of the cervix. Next is uterine sign. If you are doing the bimanual examination, you can see that the size of the uterus is getting enlarged, consistency of the uterus will be soft, shape will be globular, and another one is Hagar's sign. Hagar's sign can be elicited between the 6 to 10 weeks, and how to elicit it means just insert two fingers in the anterior fornix, and the fingers of the other hand you just keep over the abdomen behind the uterus. The fingers of both hands can be approximated as the lower part of the uterine body is empty. The vaginal hand and the abdominal hand will be, you will be feeling as like these two fingers are getting approximated, and it is due to the emptiness of the lower part of the uterus. Only the fetus is having, it will be in the upper segment of the uterus, and it's having less size also. So the lower pole will be empty, and that is known as the Hagar sign. Next is Palmer sign, that is uterine contractions that you can feel on the by manual examination. Contractions of the uterus, if you are able to feel, that is known as Palmer sign. Next, we can see the immunological changes or immunological test. So these are the tests we are using in the first trimester for identifying or for diagnosing the pregnancy mainly. One is these tests are mainly based on the presence of human chorionic gonadotrophic hormone from the placenta. The hormone is released from the trophoblastic tissue of the placenta, and it is associated with the growing of the fetus and of the placenta, and this HCG will be present in the maternal urine, and it will be there in the maternal circulation also, and you can identify it in the maternal urine from 8 to 10 days after the conception. And in the blood, maternal blood, this HCG will be identified from 8 days after conception, and in majority of the cases that it varies from 8 to 11 days, you can tell like that. And the diagnostic test for the urine test can be done from the 23 to 24 days after conception, and later after 10 to 12 weeks of gestation, this HCG level will start to decrease. Up to 24th week, if you are looking into the levels of HCG, the curve will be like this. Day by day, the amount of HCG production will be increasing. So the amount of HCG production will get doubled in every 2 to 3 days in the early pregnancy. Up to 24th week, it will be there, and later it will maintain static or slightly it will come down. And now we can see the blood test for the human chorionic gonadotrophic hormone. Currently, we are using 4 types of blood test: radio immunoassay, immunoradiometric assay, enzyme linked immunosorbent assay, and fluoroimmunoassay. And these blood tests normally we are not performing for all the ladies. For identifying the pregnancy in the earlier stage, normally we are using the urine pregnancy test. That is, the urine will be having HCG, and we are detecting the presence of HCG in the urine. That's the thing we are doing normally, and for that we are using the cards. But if the mother is having bad obstetric history, or if you are suspecting ectopic pregnancy, in that cases you can go for the blood test. That is, bad obstetric history means if she is having the previous history of death of the child, if she is having the history of ectopic pregnancy. Ectopic pregnancy means pregnancy that is the child, the fertilized ovum is getting embedded outside the uterus. That is, sometimes the fetus may be growing inside the fallopian tube, or inside the ovary, or in the abdominal cavity. So those things are the ectopic pregnancy. If you are suspecting such cases only, we are going for the blood test. And now let us see the radioimmunoassay. The sensitivity of this radioimmunoassay is 5 ml units per 5 milliunits per ml, and it will take around 4 hours for the test. And post conception age, that is from between 10 to 18 days, it will be positive. And gestational age, if you are calculating between 3 to 4 weeks, it will be positive. And immunoradiometric assay, it is more sensitive, and the sensitivity is 150 milliunit per ml, and it will take 30 minutes time for this test. And after the conception, between 18 to 22 days, if you are doing it, it will be positive. And if you are thinking about the gestational week, within 4 weeks, it will be positive. And next is immunoradiometric assay. It is less sensitive. Its sensitivity is that it will identify if 1500 milli units per ml is there only, it will identify, and it will take around 2 hours for the test, and it will be positive between 25 to 28 days after the conception. And if you are considering the gestational age, it will be positive from 5 weeks onwards. Next is enzyme-linked immunosorbent assay. This is more sensitive when comparing to the immunoradiometric assay. The sensitivity is, that is, it will identify even if the blood level is 25 milliunits per ml. And it will take 80 minutes time for the test. And between 14 to 17 days after the conception, you will get the positive test. And if you are calculating the gestational age between 3.5 weeks, it will be positive. Next test for detecting the presence of HCG in blood is fluoroimmunoassay. It detects a sensitivity of even 1 milliunits of HCG in 1 ml, and it takes 2 to 3 hours time for the test to complete, and you can identify you will get the positive result even after 14 to 17 days after the conception. And if you are thinking the gestational age, after 3.5 weeks of pregnancy, you will get the positive result. Next is the ultrasonography. Ultrasonography is the confirmatory method for diagnosing the pregnancy in the first trimester. And if you are going for the ultrasonography, you can see the gestational sac between 29 to 35 days of gestation, and yolk sac also will be visible within 5 menstrual weeks. And by 6th week, you can identify the fetal pole and fetal cardiac activity also. By 7th week, you can identify the movements of the embryo, and the Doppler effect in the ultrasonography can pick the heart rate reliable by 10th week. You can identify the heart rate by 6th week, but reliability of the heart week or confirmatory you can do by 6th week. And now we can go to the second trimester of the pregnancy. So already we have seen what are the signs and symptoms that will help you to diagnose the pregnancy in the first trimester, and we have seen the confirmatory test also. Now we are moving to the second trimester, that is between 13 to 28th week. The signs and symptoms during the first trimester include amenorrhea, that is absence of menstruation, morning sickness. Sometimes the early morning sickness and vomiting, it may persist even in the second trimester also. And another important thing is quickening. Quickening is the perception of fetal movements by the pregnant woman. That is first fetal movement perceived by the mother. That is known as the quickening. And in the case of primigravida mothers, it will occur between 18 to 20 weeks. And in the case of multigravida mothers, it will occur between 16 to 18 weeks. Primigravida means a woman with her first pregnancy. Multipara means those who had multiple pregnancies. And another one is enlargement of the abdomen. And if you are doing the abdominal examination, if you are observing the abdomen, you can see the linea nigra. That is this pigmented line, dark brownish pigmented line that is extending from the xiphoid process of the sternum to the symphysis pubis. This is known as linea nigra. Next is stria gravidarum. That is, it will be both pink and white will be there. That is visible. It is more visible in the lower portion of the abdomen, especially towards the flank region. And these are the stretch marks. This is due to the excessive stretching of the skin. We know in the physical examination, we used to do inspection, palpation, percussion and auscultation. Here, actually, we are not doing the percussion, but we are doing inspection that we have seen already, and palpation and auscultation also we are supposed to do. Now let us see about the palpation. In the palpation, first you should see the fundal height. You should check the height of the uterine fundus. That is, height of the uterine fundus you are checking from the symphysis pubis, that is from the upper border of the symphysis pubis to the fundus of the uterus. The fundus of the uterus in this picture, it will be somewhere here, and from here to the symphysis pubis to the uterine fundus, that symphysis fundal height you are checking. And this fundal height will increase according to the gestational age. And we know actually the uterus is a pelvic organ. It will be inside the pelvic cavity. By 12th week, it will enter into the abdominal cavity and it will become an abdominal organ. See here, it has just entered into the abdominal cavity and you can feel it just above the pelvic brim as a suprapubic bulge. And at 16th week, it will be in the midway between umbilicus and the symphysis pubis. In the midway between umbilicus and symphysis pubis, and at 22 week it will be at the level of the umbilicus, and at 28th week it will be midway between the xiphoid process of the sternum and the umbilicus, and by 38th week it will reach up to the level of the xiphoid process of the sternum, and by 40th week, see, you can see this dotted line, it will come down. At 38th week it will be up to the level of the symphysis xiphoid process of the sternum, but by 40th week it will come down. Why means by 40th week, that is near to the time of delivery, the fetal head will enter into the pelvis or enter into the symphysis pubis. It will come down. So when the baby is coming down, naturally the height of the fundus also will decrease. So that's all about the height of the fundus. The uterus usually is ovoid in shape during the pregnancy, and it will be soft and elastic. And another one is Braxton Hicks contraction, that is intermittent painless contractions of the uterus, and you can feel it when you are doing the abdominal examination. And the mother will be able to identify the fetal movements. The active fetal movements will be able to feel from the 20th week onwards, and external ballotment, that can be elicited by 20th week during the abdominal examination, and we can palpate even the fetal parts from 20th week onwards, and very clearly you can identify the fetal parts from 28th week onwards. Next is auscultation. In the auscultation, the fetal heart sound you can hear from 24th to 20 to 24th week by using the normal fetoscope or by using the normal stethoscope. And the sound of blood, when the blood is passing through the umbilical artery, it will produce a sound that is known as fetal shuffle or phonic shuffle. That also can be heard when you are doing the auscultation. And when the blood is flowing through the uterine artery, that also will make a sound that is known as uterine shuffle, and that will be heard as like a systolic murmur, and usually it will be at the sides of the uterus, and it will be in synchronous with the maternal pulse. Next investigation in the second trimester is sonography. You can do the routine sonographic examination, ultrasonography, between 18th to 20th week of pregnancy, and it will help you to identify the fetal anatomy, location of the placenta, and you can identify whether the cervix is fully closed or not. And even the fetal organ anatomy also can be identified. Even fetal sex also can be identified, and we can make sure that the fetus is alive. And the radiological examination, if you are doing, that is if you are taking X-ray between after 16th week, you can see the fetal skeletal shadow. And now we can move to the diagnosis in the third trimester, that is between 29th to 40th week of pregnancy. The symptoms that you can see in the third trimester of pregnancy include amenorrhea, that will be persisting, enlargement of the abdomen will be there, and finally by 38th week, the lady will be getting a discomfort due to the large abdomen, because this enlarged abdomen will be, or this gravid uterus or uterine fundus will be applying pressure over the diaphragm, and that leads to the palpitation and dyspnea. Even if she is doing mild work also, she will get that exhaustion. And after 38th week, lightening will occur. That is, already I told you that by 40th week, the size of the uterine fundus will decrease. It will come down to around the size of that is 2 cm below the xiphoid process of the sternum, or almost where it was at 36 to 34 to 36 weeks, it will come to that level. and it is due to the process of lightening. Lightening means, already I told you, when the fetal head is moving downward or when it is entering into the pelvis in the process of delivery, in the birth process, when the baby is coming downward, naturally the size of the uterus will decrease, or the size of the, not the size of the uterus, length of the uterus will decrease, that is symphysis fundal height will decrease, and because of that decrease the lady will get a relief from the dyspnea and palpitation. That's why we are calling that feature as, or that symptom as, lightening. It is nothing but when the fetus is coming downward or when the fetus is descending downward, the lady will get a relief from his palpitation and dyspnea that has occurred due to the gravid uterus. So that relief is occurring for the woman, or that she is getting a relief from the pressure symptoms, and that is known as the lightening, and it is due to the engagement of the presenting part. Engagement of the presenting part means the part which is present in the lower pole of the, or lower part of the uterus will enter into the pelvis. And due to this, the lady will get the frequency of micturition, frequency of urination, because when the baby is coming downward, again it will start to apply pressure over the bladder. So because of that, she will get the frequency of urination, and the fetal movements will be more pronounced, or it will be more. And if you are coming to the signs in the third trimester, skin changes will become more prominent. That is, stretch marks, maximum stretch marks will develop over the abdomen, and the increased pigmentation over the skin will be there. And if you are looking into the shape of the uterus, it will become cylindrical or spherical around 36 weeks. And the fundal height, already I have given an explanation about the fundal height. It will be at the junction of the upper and middle third at 32 weeks, that is between umbilicus and xiphoid process of the sternum, or we can call it as ensiform cartilage. And at 36 week it will be at the level of the ensiform cartilage, and again by 40th week it will come to the 32 week level because of the engagement of the presenting part. And symphysis fundal height. The upper border of the fundus can be located by the ulnar border of the left hand, and that point can be marked, and the distance between the upper border of the symphysis pubis up to the point marked in measured in is measured in centimeter. That's the way of checking the fundal height. That is, first you have to identify the upper border of the symphysis pubis, then you should identify the upper border of the uterine fundus, and you should take the length in between these 2 points, and by that way you can assess the symphysis fundal height, or you can take the fundal height. In 24th week, the symphysis fundal height will be in corresponds to the, after 24th week, the symphysis fundal height will be in corresponds to the gestational age. That is, if the gestational age is 24, the fundal height also will be 24. If the gestational age is 36, fundal height is also 36 centimeter. Up to 36 week it will be 20, that is between 24 to 36 weeks it will be same as that of gestational age if the baby is having normal growth. And another one is Braxton Hicks contraction. Already I have told you what is Braxton Hicks contraction. It will become more evident, and fetal movements will be more, and it will be easy for you to feel, even for the mother also. And even the palpation of the fetal parts also will be easier, and you can identify the fetal parts, and fetal heart sound you can hear more distinctly. And if you are going for the ultrasonography, we can assess the growth of the fetus, and you can assess the amount of amniotic fluid also. And already I have told you, if the amount of amniotic fluid is less, we are calling it as oligohydramnia, and if it is more than 1 liter, we are calling it as polyhydramnia. By taking the amniotic fluid index, you can assess whether polyhydramnia or oligohydramnia is there or not. In case if you are having any doubt, you just go through the previous video about the fetal membranes and amniotic fluid. Next is the differential diagnosis of pregnancy. Sometimes you may miss your period at some time, and you may mistaken it as pregnancy. But in all the cases, if you are missing the periods, it may not be due to the pregnancy. It may be due to some other reasons also. So we are going to see such things. One thing, uterine fibroid. Sometimes the size of the uterus will be increasing, and you may feel that the size of the uterus is increasing and your tummy is increasing, or you may think you are having a pregnancy, but it may be due to the presence of a uterine fibroid, and this uterine fibroid, because of the uterine fibroid or because of the hormonal abnormality along with the enlargement of the abdomen, you may miss the normal cycle also, normal menstrual cycle also. And another reason is cystic ovarian tumor, polycystic ovaries and other tumors of the ovary. In that case, amenorrhea will be there, or absence of menstruation will be there, and the positive signs will of other positive signs of pregnancy and the ultrasonography findings will be negative. In that case only amenorrhea will be there. And another one is encysted tubercular peritonitis, that is, in that case swelling of the abdomen or size of the abdomen will be increasing. But if you are going to for the examination, the lady will be having the history of Koch infection, swelling will be there, and all the positive signs of pregnancy will be absent. And in the ultrasonography also you can confirm whether it is a peritonitis or pregnancy. And in the case of hematometra, or you may mistaken it as pregnancy, and if the urinary bladder is distended, sometimes you may think that it's the beginning of the pregnancy, and you can catheterize it and you can solve the problem. And another reason is pseudocysis, that is false pregnancy. Sometimes the lady may think psychologically that she is pregnant, and because of that psychological process she may miss the periods and she may think that she is having the pregnancy. So these are the main important differential diagnosis. Thank you for watching this video. In this video we have seen almost all the important measures that will help you to identify the pregnancy, and that will help you to identify the growth and development of the baby in the first, second and third trimesters of the pregnancy. Thank you once again. See you later with a new video.